Welcome to the office. Hi, Christina.
Hi.
Welcome to the office.
Thank you.
How can I help you? What you doing here?
What am I doing here? Well, I've had a lot of back issues over the years. My whole body's felt very, very stiff. I want to say just within the last 5 years, more lately.
So stiffness is your motivating factor.
Stiffness, yes. Just kind of want to get back to
Whole
how
body
it used to be.
or low back?
Low back mostly.
Okay.
Yes, I've had issues in the past, I want to say, with it's usually up here, but that's usually muscle tension, not so much.
Well, we're going to talk about all that.
Yeah, I'm sure you probably see more than I do with that, but no, yes, I kind of want to get back to normal. I do work warehouse.
Okay.
So, but luckily the place that I'm at now, it's not.
Is there a lot of lifting?
Not as much. What I do now, luckily we have kind of machines where we just push things through. But previous job, yes, was a lot of heavy lifting.
Got it. Major accidents, trauma, slips, falls that you remember?
Oh, well, let's see. Teenage years, skateboarder.
Okay. Yeah.
So definitely a lot of falls.
Bowls, street. Half pipes.
Yes.
Oh, nice. Okay.
So I have wrapped myself before. I've fallen in bathtubs before and hit the spout to where it felt,
Okay.
But kind of did stretches, things like that. Had family members help with things.
So number one is back stiffness. Mm-hmm. Spine, whole body stiffness, or just isolated to the low back?
I'd say spine and probably towards hip area
Hips,
too.
and then we're getting tightness in the shoulder area.
Yes, and I always thought it could have been more muscle.
Well, we're going to talk about the relationship based on the posture and how the muscles are working in or out of balance. And I'll explain all that.
Posture too. Okay. Sometimes it hurts to actually sit up straight like I'm supposed to.
Okay.
I don't know if that's a tall thing because I've noticed that from a lot of tall females too. We have the same complaint.
Well, I think part of what happens, because my daughter is tall, my older daughter, and I notice she slouches like this because most of the people she hangs out with are shorter. So the habit of doing this, and I said, Rumi, you need to stand up tall. And those habits that developed over the years change the ligament and muscle pattern. But we'll see on your x-ray what's up, okay?
Okay.
All right, anything else?
No, as far as I could think of, that kind of sums majority of that up.
Well, I mean, to be here is a big deal. So, she's kind of downplaying it, guys. It's a big deal to be here. I get it, okay, to get out here and even you're local, considering an hour drive is still local for us. So I know you've been dealing with this for a while, okay? And along the way, as I explain stuff, you have questions, you ask. Okay. If you're uncomfortable with anything, your bodyguard's there, okay? And it may be a little spicy today.
Okay.
All right, just letting you know.
All right.
Let's go over your x-rays.
Okay.
You ready?
Yep.
Think of this as your 24-story building. In order to have a stable building, you need a level base and foundation. So the first question is, do we have a level base and foundation? No, we do not. So let's go over this one first. And let's look at your foundation. So a couple of things going on here. We have a rotated pelvis. We have a rotated sacrum that's dropped 3 millimeters on the left side. And we have a lowered leg, or we call it a leg length discrepancy or a low leg, not a short leg. Okay, follow. Now, it shows 10 millimeter measured difference. According to this work on the level foundation principle by Dr. Gonstead, this is the method that we follow. This needs to be under 7 millimeters for any of these adjustments to hold. Follow my process. Right now you're at 10. We need to get under 7. 3 of it is coming from here. That's 7. Fixing the pelvis will get it up 1. So we get right to about there. Okay? Now, let's put this part together. This is your left SI joint. Or I'll even do the right one. It's a little easier. We have the rotated sacrum on the side of the rotated pelvis. The sacrum goes back 4, down 3. The pelvis goes down 1 and in, and then the whole thing goes down. Now, here's the interesting part. The overall effect is your foundation wants to go to the right, but your short leg wants to bring it to the left. That's your imbalance. And that you've had for a while, so I'm sure when you walk, you got the little wiggle when you walk. I'm pretty sure she got the wiggle. Okay, what do I mean by that? Your body goes right, short leg brings you back left. So instead of the dimples up and down, I'm assuming it's going to be doing something like this. And we'll see it in your walk. Does that make sense?
Yes.
Okay. From there, I'm going to continue. There's a normal variant finding. I'm just pointing it out, and there's a reason. When we look here at your S1 tubercle, we have what's called spina bifida. You can Google spina bifida. This is not the serious case you're going to see on Google, but I'm pointing it out for a reason. During embryological development, all these bumps on the back form by the lamina fusing together. This piece here, this is the lamina, and they form these bumps on the back. Same thing happens in the sacrum. Your first sacral segment failed to form completely. There's a little gap right there. And why it's important is when I touch it, it's going to be tender, but it's not the cause.
Okay.
That's why I'm pointing it out. Okay? And when I'm done with what I do with you today, I'm going to go back and touch it, and it's going to be better. You'll see. Okay? So that's a normal variant finding. I'm just pointing it out because when I examine you, I'll touch it. If anyone has worked on you without x-rays in the past and touches it, that hurts, but it's not the cause. Got it?
Got it.
Follow the process. As we go up the spine, the slightly lowered leg gives you a little curve to the left, but not too bad. That's the good news. All of this, but slight curve, but then what happened up here?
Yeah.
That's why part of the reason your muscles are tight. You have this kink in the spine. This is not from posture. There was some trauma that happened here. You have a T2 side slip. You have a T4 side slip. Now follow. I'm looking at these circles here, okay? The circles are called pedicle shadows. They tell us the rotation of the bone. Now watch this. Big, small. Big, small. Switches. Big, small, big, small, big, small. You see the switch?
Yeah.
And that's happening in here. So whatever's going on in here is a compensation for down here. Make sense?
Yeah.
Okay. Now, as we go up the spine, you had some fun stuff up here. All right. 1, 2, 3, 4, 5, 6. 5, 6. It's starting at 5, 6. And this is the area that controls the stomach and the gallbladder, the stomach and the liver.
Wow.
Digestion. Okay. Now, here's what I want you to see. The spine kinks like curves this way. That curvature makes your left shoulder look higher. It's not. It's the curve in your spine from your posture. It makes these ligaments and muscles shorter. So when you're sitting, this gets stiff. You get up and you feel like popping this side.
Question.
Yeah.
Does this look like something that's been there for a very long time?
I'm going to get there, yes. It's been there for a minute, okay? This isn't a few years ago. This is over 15, 20 years, more than that. I'm going to see it on the other X-ray.
Okay, I think I have an answer to it too.
Yep. Let's look at the side profile, and let's look at a few things here. 3 things we're looking at on the side profile: posture, curvature, and discs. First thing is actually, let's look at the curves. We should have a 40 to 60 degree forward curve in the neck, 60 in the mid-back, 60 in the low back. You have less curve in the spine here. This is okay. This needs a little more curve. That's going to be through not just adjustments, habit changes, which I will go over. Now, posture line. We run a posture line from the lowest lumbar. We run it straight up. And your scenario is this. So it's actually not bad. You have forward head posture, not most of the people I see here are at the back.
Yeah.
So if we look at forward head posture, for every degree past neutral times 10 is what the lower cervical spine feels. So that pain you're feeling, if we take a modest 8 to 10 degrees times 10, you're holding 80 to 100 pounds on your neck. So that's posture. Follow. And I'll, like I said, I'll go over the stuff of what you need to do with that. Now, let's go look at your discs. Now the good news, overall, the discs are great. Okay, let's go down in the tailbone and see where this all started. Coccyx is good, S5. I'm seeing S4, S5, S3, S4. So when we're looking at the tailbone, it should be a smooth curve. You kind of bent forward and then back. Yeah. Tells me you had some good injuries as a kid. Yeah. Okay? Whether you played hard or someone played hard with you, something Both. Like that. Okay? Now, so we have S3, S4. This disc is a little bit less, but it's still great. Okay? Still great. Your L4 is great. These discs are fantastic. This one is tiny bit less, but it's because there's no curve, so it's taking up a lot of the shock absorbing mechanism. But overall, discs are great. You had an old compression injury in the middle of your back here. You got squished. Yep. Overall, discs are great. 2, 3, 4, 5, 6, starting at 7. You can see the whitening of the bone right there. We call that enuberation. What is enuberation? It is a thickening of the bone. The body is laying down a little more bone there to stabilize the instability. Because you're like this, too much weight is put on those muscles and ligaments, so the bone is trying to strengthen up a little bit. See, when I look at the shape of the disc, it's about maybe 18 years ago, whatever happened there. Okay, somewhere around there, 18, maybe 20. But this is the one that's the least out of all of them. You see that? Mm-hmm. The disc height. Yeah. So we have 2, 3, 4, 5, 6, 7. See 7. We have S3, S4. Okay. And now I'm going to change one thing up a little bit. If we want to get more curve in the spine, and I've talked a lot about it in the past too, then what we want to do is we want to work on the IN ilium when it's time. The IN ilium or AS major will cause a straightening of the spine, and it does it this way. There's a process called nutation and counternutation. It's the way the SI joint moves. When the pelvis moves up, the sacrum comes back. When the sacrum goes in, it's almost like it's up, still comes back. So IN ilium in makes this come back a little, causes a slight straightening of the spine. Okay. However, when we have a rotated sacrum on the side of an IN major, the book says to do the tailbone first, the sacrum. But I'm not starting here. I'm down low, bringing it up. Right. Okay. Follow? Mm-hmm. Good. All right. Questions so far on this X-ray? Is that clear?
No, that's very clear.
Okay. Now, last thing going over this is there's TMJ issue. Do you want me to deal with your jaw? Do you have any jaw issues?
A little bit, yes.
Okay. So there is jaw deviation. There's a little bit of septum breathing. Is she snoring?
Sometimes, yeah.
You want me to deal with your nose too?
Sure.
Okay.
Might as well. I'm here.
We'll check the nose and we'll check the jaw too, okay? And the last thing we want to talk about is digestion.
Oh, yeah.
So when I'm looking at digestion, the first thing I'm looking at is the Megan-Blasi, which is that. It should be a big black half circle. This is gas in the colon, separate. So we don't see the correct size and shape Megan-Blasi. We have a lot of undigested food going through and gas being produced. What does that mean? It means you're not absorbing and assimilating your nutrients as well as you can. Okay? You ready?
I'm ready.
Let's do this.
Let's do this.
I have a good friend from high school. She's a physical therapist. Hi, Jackie. And Jackie and I had this conversation years ago. And I love it and I use it all the time, but I give her credit for it. Rahim, muscles receive instruction they don't give. Make sense?
Yeah.
They receive instruction through the nervous system, through the proprioceptive mechanism, and they're just doing their job. Now, here's an interesting thing with that. BMR, basal metabolic rate, the minimum amount of energy to just exist, just to be. When we're out of alignment and we have postural shifts, these muscles are working overtime, just like we talked about with forward head. So when the muscles are working out of balance, you're using more energy. You get tired faster.
Makes sense.
Okay. You ready?
I'm ready.
Let's do it. Starting at the base. First thing we're getting, C7, 10 points. Left side. Oh, yeah. C1, right side, 4 points. C7, left side. 10 points. T6. Oh, you in for a treat today. Did not stop there, did not break yet till we get down in the low. S3, S3, S4, left side, T6, C7, C1. Those are the 4 majors that I'm getting right now, okay?
Okay.
Let's go ahead and test the hips out next. Feet together. Open and close your knees with your feet touching. Open and close, open and close. Checking general motion of the SI joints. My hands are here on the top of the iliac crest and on the dimples here. And just from me holding it, you can see my left side is lower, my right side is higher. Go ahead and do the right side only, please. Open and close. When she does the right side, the left is shifting a little bit due to fixation. Do the left side only, please. When she does the left, though, it's moving way more because there's more fixation here. You feel that?
Mm-hmm.
Good. Scoot back for me, please. Let's do static palpation, running my fingers down the spine, head down. And static palpation, we're looking for swelling, edema, point tenderness, and redness. Do-do-do-do-do-do-do. 1, 2, 3, 4, 5, 6. That one more or that one?
Right there.
How about the one below? No, right there.
Right there.
Head down, please. 1, 2, 3, 4, 5, 6. It's actually 7. That's the sugar button. She like them carbs, huh?
Yeah.
Ah.
Bread.
Bread. You can see that swelling edema right there, and it pools right there at 7. This is good. The edema starts there, and it pulls in the tailbone right here. Okay. Let's check the sacrum. Back slowly towards me, please. All the way back in extension. Lean back. Hands on your knees, please. Good. Come back slowly. 5. 1. Tender. 2. Tender. 3. More tender. Yes. 4. More tender. Yes. 5. Tender.
Not that bad.
Not as bad as 4. 4 on the left. Okay. So now you know, right?
Mm-hmm.
All right, just saying. Sit back for me, please. 7, 6, 5. Lateral flexion to the right versus the left. More stuck there. Turn left, turn right. C7. Bend left, bend right there. Yes?
Mm-hmm.
Let's check the jaw movement. Look straight, look up a tiny bit. Slowly open the jaw, open, open. Left goes out first, keep going, keep going. Right pops out. So we have a left AI, right EX. Let me explain. This is your jaw. Close the mouth, look down. So when you open the mouth, the jaw does this and then this. So we're going to check it after the spine adjustment and see if we need to work on it.
Okay.
Last thing, looking at the septum. Right side is fine. Tiny bit on the left. Tiny bit. Okay. Stand up. Let's watch the walk. So we want to see the dimples here. They should be moving up and down like this when you walk. Go ahead and walk to the corner or to the wall and back. Regular walking. You walk like this? Like you're ready to run up on somebody?
No.
Walk.
Kind of like this.
Just walk.
Again?
Keep going. Yeah, she got the Claremont Shuffle. So when you're walking, it's like,
My dad always called it, you got the diddy bop.
oh.
He's military. He thought I had a cool walk on purpose. He's like, are you trying to do that diddy bop cool walk? I was like, no, Dad.
When was that? How long ago?
Probably 18 to 20 years ago.
Well, then that's probably makes more sense now. Cool.
Yeah.
Keep walking. Now, how long you walk with your feet out like that too?
It varies. So my feet can go out sometimes, and then sometimes I'll notice I'll walk with straight feet. So it does vary.
Interesting.
When I'll like pay attention, I've seen it where it'll come out a little bit, and then some days it's...
So the reason I ask that, whenever we see someone walking with their feet out, that's usually an upper cervical issue, and I ask how long ago. Usually it's from an old fall on the head. Now, your upper cervical does look a little bit unstable there, and what my suspicion is, when your neck goes out, your walk changes. Something to look at. But we're going to fix that. Have a seat. Game plan. This is what we're going to do. We're going to start with... We're going to do S4, sacrum, there first.
Okay.
Then we're going to go here, do more of S4.
Okay.
After that, I'm going to do T7. Have you walk, work on the neck. After that, I'm going to tune up your extremities, ankles, shoulders, elbows.
Okay.
And jaw.
Oh, perfect.
Okay, right side down. Bottom leg straight, top leg bent. Bring your whole body forward. There. Bottom leg straight, top leg bent. I got you the whole way. I will not drop you, okay? Hold there, hold the wrist. Bring this forward. There we go. Bring the butt forward. There you go. Straighten that. I won't drop you. Free trip to Hawaii if I do. There it is.
Oh.
Gotcha. Home run. Hey. Come on in. Whoa. Let's go over here, face down. And for this one, we'll use the drop board. Sound is the board, not your back breaking, okay? She's like, okay.
Okay.
S4. Okay, use the drop. And we want to torque up on the left side. Good. Almost. There it is. Gotcha. Now, T7. T7. A little more. There you go. Nice. You ready? Mm-hmm. Feet together. Wait for it. Hi.
Hi.
Wake up. Okay. Slowly. And let's have you walk back and forth a few times. Let your body kind of figure out what just happened.
Yeah, that is weird. Wow.
Turn around.
Wow.
First thing you're going to notice is the swelling is down. It's cool. Walk. It's different.
Yeah. At first I was like, am I gonna? And then I stand up. Wow.
Keep walking.
Okay.
Keep walking. Tell me what's different right now in your feet.
I feel like they're more straight. Like without even looking, I can kind of tell. Wow.
Ready for more?
Yeah, let's do it.
Let's do it. Have a seat.
Came for the fun. There we go.
Came for the crack, stayed for the knowledge. Sit back for me, please. C7. La da 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 da. We're coming under 7, chin back. Stack the vertebrae, laterally flex. You want to get right under to lift. Relax the head, please. There you go. That's the home run. Perfect. Deep breath. C1, okay? One more. Right ear down. Perfect.
Yeah.
Clunk. Deep breath in. Pretty cool, huh?
Yeah.
Walk it off one more time. Check it out.
Wow. I'm like tingly.
Tingling good.
Yes. I came for the cracking sound, so that's where I was like, oh, yes, he got that.
But you notice it wasn't a high-pitched crack. It was a clunk.
Yeah.
It's a different sound.
Wow. Yeah, I can feel a lot of the difference.
Come on back. Have a seat.
Wow.
Good times. Let's ReScope. Good stuff. Look at how you're sitting now. It's easier to sit.
Yeah.
Pretty cool. Neck is clear. 7 is clear. Tailbone is clear. Let's go ahead and feel it. Check it out. Come on back. Don't be scared. Come on. Come on. 5.
Wow.
That's 1. That was the spina bifida. Better. 2.
Wow.
3.
What?
And that's 4.
Oh my God.
Rahim.
Oh.
May I continue?
Yes, please.
Ears.
Ah!
Shoulder. Let me do it. Let me do it. Let me do it. There you go. Let's check the jaw. Center on the chair, please. Scoot to the right. There you go. All the way back. Let's just see if the jaw shifted. Open, slow. It's actually better. Open. Still there, but better. We're going to work on the jaw. Let's do the right EX first. Open all the way. Open, 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 open. Close halfway. Hold. Pushing right to left. There you go. Open. Close. Open. Close. Open. Slowly close. Close, 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 close. Good.
Wow.
Stand up. Check the hands. Squeeze my hands. Squeeze. Squeeze. You die. Elbow. Lunate. Scaphoid. Thumb.
Wow.
Squeeze. Squeeze. Ulna. Lunate. Scaphoid. A little more.
Wow.
There you
Yeah,
go.
stubborn one.
Squeeze now.
Wow.
Squeeze.
So I got that good interview shake now?
Yes. On your back. Now we got to do your feet. And we're just going to do the talus, AS talus. AS talus. Up. Sit up and turn. And now the final buff and polish. This is vibration therapy to break up scar tissue. Look to the left, all the way. Look to the right, all the way. Different?
Yes.
Look straight.
Wow.
And that's where we're going to start, Christina. Questions for today?
No, you pretty much were very detailed and answered a lot of history.
Stand up for me,
wow.
please. Cool. Welcome to the office.
Thank you so much.
You're welcome. So I'm going to have a few visits with you.
Okay.
And then we're going to figure out where to go from there.
Okay.
You have any questions?
No.
Questions?
So far, so good.
Good? Enjoy your day.
So much.
You got it.
Thank you so much.
You're
Oh.
welcome.